Chronic pain is a pervasive and rapidly growing health problem in the United States, affecting over 50 million adults. On the Mel Robbins podcast, renowned neurosurgeon Dr. Sanjay Gupta shares groundbreaking insights and practical guidance on healing the body, living pain-free, and feeling better now. The conversation sheds light on the often misunderstood nature of pain, the distinction between acute and chronic pain, the roles of the brain and lifestyle factors, and promising interventions grounded in cutting-edge science. Dr. Gupta begins by explaining that pain, though universally experienced, remains one of the most mysterious human sensations. Acute pain serves as an immediate alarm system designed to protect the body from injury or harm, like pulling your hand away from a hot pan. It signals a real-time problem and encourages avoidance of further damage. Chronic pain, however, is a different phenomenon. It persists beyond the expected time of healing, often lasting for months or even years, despite there being no ongoing injury or harmless structural abnormality. Medical standards often define chronic pain as pain lasting more than 3 months, but the experience varies. What sets chronic pain apart is that it becomes a complex condition involving the brain's decision-making processes. Dr. Gupta emphasizes a crucial neuroscience truth. All pain exists in the brain. The brain integrates sensory input with emotional, psychological, and environmental context to produce the pain experience. If your brain does not decide something hurts, then technically, you do not feel pain. This central role of the brain explains phenomena like phantom limb pain, where a person experiences pain despite the absence of the physical limb, and chronic regional pain syndromes, where pain occurs without clear injury. Thus, chronic pain is often less about ongoing tissue damage and more about the brain's memory loops and neural circuitry perpetuating pain signals. The discussion highlights that chronic pain is not just an issue for the elderly or those with obvious injuries. It is widespread, growing faster than conditions like dementia, diabetes, or cancer. Chronic pain deeply affects daily life for millions, interfering with work, relationships, and overall well-being. For about 17 million people, the pain can be so severe it completely disrupts their ability to function normally. Dr. Gupta's personal observations align with this. Patients negotiate pain every day, thinking about it from morning until night. What makes pain so complicated is how deeply it interacts with a person's entire being. Pain is influenced by previous experiences, sleep quality, emotional health, stress, environment, and even cultural context. For instance, 2 people with the same injury can experience dramatically different pain levels depending on factors such as mood, past trauma, anxiety, depression, or sleep deprivation. This integrative nature of pain opens both challenges and promising new treatment opportunities. Dr. Gupta stresses the term baggage when referring to the psychological and physiological cofactors that worsen chronic pain. This baggage includes depression, anxiety, poor sleep, stress, social isolation, and a history of previous pain episodes. These elements are deeply intertwined with pain in a two-way relationship. Baggage amplifies pain, and pain worsens baggage. For example, pain interrupts sleep, but poor sleep intensifies pain, creating a vicious cycle. Modern pain medicine often neglects this complexity by treating pain simplistically and predominantly through medications or procedures that address only the symptom and not the underlying causes. The opioid epidemic, heavily linked to the U.S.'s tendency to medicalize pain quickly and pharmacologically, is a stark illustration of this limited focus. Dr. Gupta notes staggering data. The U.S. comprises less than 5% of the world's population, but consumes 90% of the world's opioid medications. This cultural and medical overtreatment neglects integrative approaches addressing the multifaceted nature of pain. One of the most hopeful elements Dr. Gupta raises is the body's inherent capacity to heal itself if optimized correctly. Contrary to traditional rest, ice, compression, elevation protocols often used for injuries, emerging research suggests that resting and suppressing inflammation in the short term might increase the risk of pain becoming chronic. Movement, active mobilization, and allowing natural inflammatory processes to work support healing. Dr. Gupta introduces the MEET protocol: mobilize, exercise, analgesia if needed, and treatment, like physical therapy, as a more effective strategy that emphasizes movement and engagement rather than immobilization. Encouraging movement helps promote blood flow, bring healing molecules to injured sites, and rewire the brain's pain circuits through neuroplasticity. Neuroplasticity, the brain's ability to change and reorganize itself, plays a central role in retraining pain perceptions. Dr. Gupta explains that pain circuits integrate memory, emotion, and sensory processing, involving brain areas such as the amygdala, hippocampus, and prefrontal cortex. Chronic pain involves maladaptive memory loops that reinforce the pain experience, but because neuroplasticity is neutral, it can also be harnessed to rewire pain signaling and reduce suffering. Dr. Gupta highlights several exciting and scientifically supported interventions aimed at both body and brain. Meditation and mindfulness. Guided meditation protocols, such as mindfulness-oriented recovery enhancement, have been shown in clinical experiments to reduce both pain intensity and unpleasantness, sometimes bearing similarity in efficacy to low doses of opioid medications, but without the risks. Virtual reality. Used especially in some emergency rooms, VR can distract and calm the brain, lowering pain scores rapidly. This is theorized to work through activation of the body's endogenous opioid system, the natural production of opioid-like chemicals that reduce pain and elevate mood. Holistic management, addressing sleep, reducing stress, managing mental health conditions, and physical exercise are integral to breaking the cycle of pain and improving quality of life. Dr. Gupta underscores the danger of over-medicalizing pain. For acute injuries like a hip fracture, ER treatments increasingly favor nerve blocks and multimodal pain management strategies that reduce reliance on opioids. Similarly, patients with chronic pain benefit from a team approach that includes psychologists, physical therapists, and pain specialists working together to tackle all pain baggage. One of the most powerful takeaways from the podcast is the necessity of shifting how people think about pain. Pain might feel overwhelming, permanent, and purely physical, but Dr. Gupta encourages listeners to understand it as a system involving the brain's complex decision-making and memory. Recognizing that pain is created by the brain does not diminish its reality, but opens possibilities for treatment beyond medication and surgery. Fear, he explains, often keeps people from moving and engaging in life, which paradoxically worsens chronic pain. Once structural issues are ruled out by a medical professional, movement, even gentle stretching or walking, is the best medicine. Retraining the brain, building resilience, and managing emotional baggage are essential steps. For those living with difficult conditions like TMJ or persistent back pain, incorporating mind-body approaches such as meditation, physical activity, stress management, and sleep hygiene can lead to significant improvements. The conversation closes on an empowering note. Dr. Gupta's wife Rebecca's personal chronic pain journey inspired much of his research and the writing of his best-selling book, It Doesn't Have to Hurt. Despite years of pain that impacted her life severely, integrating multiple approaches eventually led her to remarkable recovery, including completing a triathlon. Their story exemplifies the promise of the science discussed. Dr. Gupta encourages people in pain and their loved ones to understand that pain does not have to last forever, and relief is possible. The first step toward healing is greater self-awareness through journaling pain, identifying triggers, and partnering actively with healthcare providers. Chronic pain may be complicated and sometimes cruel, but new knowledge and integrative approaches offer a path beyond suffering.